that we are making an environment that supports our bedside nurses. We are the ones that are doing the nitty gritty, day to day hard work.
Healthcare workers have pretty much been going nonstop since the beginning of COVID. Some of the hardest hit are nurses.
Now there's a projected shortage of 1 million nurses coming in 2030. 25 News reporter Nikema Simon talked to nurses in Central Texas about what's behind those numbers.
Over 20 years, Dawn has stood by the bedside of patients here in Central Texas while teaching the next generation of medical professionals to do the same.
I am still a bedside nurse. I work bedside. I also teach future nurses.
But for 2 years, the profession she once knew took a major shift.
You're in there actively helping patients die, holding their hands. And I remember coming home days crying because of the fact I had patients dying that their family couldn't be there. That was just so strange for me.
Nurses are often referred as the backbone of healthcare, but according to a new study by the American Association of Colleges of Nursing, next year more than 1 million nurses will leave their fields. A new study showing that the mental health of nurses dropped by 28%.
There's a reason for that there's so many job openings. It's hard. It's a lot of hard work, and mental health and the draw that it has on us continually. I've seen nurses that have left the bedside during COVID because of that mental health demand.
For Dawn, she will continue to work in the career she loves, lending her voice to solving the challenges within her field.
We want them to stay here, and we want them to continue taking care of patients in our communities.
Reporting in Waco, Nikema Simon, 25 News.
According to the University of St. Augustine, Texas is facing one of the worst nursing shortages in the country. As of their most recent data in 2020, there are 279,000 employed RNs for a state of just less than 29 million. That's an average of only 9.6 nurses per 1,000 people. Only California, Nevada, and South Carolina have fewer nurses. And the shortage is being fueled by a growing demand for nurses across the state. The projected difference in supply and demand by 2030 is nearly 16,000. Only California is expected to see a higher difference at over 44,000.